I'm Dr. David Battin, cardiologist with the Heart Center at Salina Regional Health Center. We performed over 100 transcatheter aortic valve replacement procedures since inception.
Dr. Battin, thank you so much for coming on the show. We're going to be talking about TAVR. First of all, what is TAVR?
Well, thank you for having me. TAVR is an acronym for transcatheter aortic valve replacement. And that is an aortic valve that is mounted or hand-sewn on a stent scaffolding that we can place percutaneously or through the skin, usually by way of an artery in the groin or leg artery.
Okay, so how is that different from the traditional valve replacement?
It is considerably different as far as how we get the valve to its location. The traditional surgical aortic valve replacement usually requires an incision in the midline or through the sternum or the breastplate, and the heart is stopped and you're placed on a heart-lung machine, and the procedure takes 2.5 to 3.5 hours, depending on the complexity and what all is involved. The time in the hospital for a surgical replacement is considerably different. 7 to 14 days in the hospital, half of that being in the intensive care unit, and then a recovery time of anywhere from 30 days to 90 days, depending on how patients recover. When we place the valve through the leg or percutaneously, people can expect to stay in the hospital a day, maybe 2. Symptom relief is usually immediate, usually readily noticeable, and the recovery is vastly different.
Who is a candidate for TAVR?
So anyone with symptomatic aortic stenosis is a candidate, and generally those individuals have what we call severe aortic stenosis, which is usually identified because they have exertional type symptoms of chest discomfort or predominantly shortness of breath, and ideally identified by the primary care physician and then referred on to the heart team or the valve team at Salina Regional, where we go through some rigorous testing, and then we see them as a multidisciplinary team in the clinic with Angie Bogart, the valve clinic coordinator, and either Dr. Toon or Dr. Quintos, who are cardiothoracic surgeons.
All right, thank you so much for some great information, and thank you for watching. For more information, you may visit the Heart Center page of srhc.com, like Salina Regional Health Center on Facebook, follow us on Twitter and Instagram.